Think about all the women in your life. Your mother, your sister, your grandmother, an aunt, a cousin, a teacher, a neighbor, yourself, or a girlfriend. Now imagine one of those women being diagnosed with breast cancer. 1 in 8 women will be diagnosed with breast cancer in her lifetime. Everyone is at some risk. The first step to prevention is education. And as someone who watched 2 aunts, 2 cousins, and my mother battle this disease, and who recently had a scare of my own, I have a liberal amount of knowledge about this subject. According to the Long Island Breast Cancer Study Project, breast cancer rates are especially high on Long Island. And in honor of the recently passed Breast Cancer Awareness Month, I want to take a few minutes to inform you about who is at risk, what can cause it, and how you can help. The American Cancer Society says that there are certain factors that can't be changed that can contribute to your risk. 1 in 8 women who are diagnosed are younger than 45. 2 in 3 women who are diagnosed are older than 55. So age has a lot to do with your risk. Genetic defects can also affect your risk. There are several different kinds of genes that can be affected, but the most common are the BRCA1 and 2 genes. Normally when they're not mutated, they prevent cancer by producing a protein that actually prevents cancer. But when they are mutated, they promote cancer by causing it at a younger age and causing cancer that is more aggressive. A mutated BRCA1 or 2 gene can increase your risk of other cancer, especially ovarian cancer, and you can then pass that gene on to your children of either sex. Race also affects your risk. White women are most likely to be diagnosed, but Black women are most likely to have an aggressive form of breast cancer. Asian, Hispanic, and Native American women have a much lower risk. Family history increases your risk. If you have 1 first-degree relative, that's a mother or a sister, that has breast cancer, your risk doubles. If you have 2 or more first-degree relatives, your risk increases by 5. The most surprising risk factor is that though women are 100 times more likely, men are also at risk for breast cancer. Men with a family history or with the mutated BRCA gene are most likely to be at risk. Just as it's important to know that that you have risks that you can't change, there are outside factors that can also affect your risk for breast cancer. It's hard to pinpoint exactly what causes breast cancer, but breastcancer.org lists certain risk factors that can increase your risk. Increased estrogen in your body can be a huge cause because estrogen stimulates the growth and division of breast cells. So if you have cancerous cells, then increased estrogen would obviously cause them to divide and grow more quickly. So certain lifestyle choices like not having kids or having kids at a later age can increase your risk because having children decreases the amount of menstrual cycles that a woman has. So if you have less menstrual cycles, then you're less exposed to estrogen. Taking the pill or after menopause having hormone replacement therapy can also increase your risk because it increases your exposure to estrogen. Other risk factors are obesity, especially if the weight is gained in adulthood. Weight is kind of a tricky subject, and like Tyler said, it can lead to other cancers too. So the American Cancer Society pretty much is just like, just maintain a healthy weight and you'll be fine. Lack of exercise can increase your risk too. I read that just walking for an hour and 15 minutes a week can decrease your risk by 18%. And if you walk more, it can decrease your risk even a little bit more. Tobacco smoke can increase your risk because tobacco smoke includes includes polycyclic aromatic hydrocarbons, which can increase your risk by 50%. PAH are also in air pollution and contaminated water, which is a lot of why people think that risk is so high on Long Island. So since breast cancer can affect literally anybody, it's important to know that you can help. There are a lot of charities that give money to research, and the National Cancer Institute does research specifically to do research on Long Island about the environmental causes of breast cancer. But it's important to know where your money goes, especially during Breast Cancer Awareness Month. Like, every company slaps pink ribbons on their products, and you think that money's going somewhere, but that doesn't necessarily mean that it does. So it's important to know where your money's going. There are also charities, like local charities. Every town has a breast cancer coalition that helps women in your town. They can take women to doctor's appointments if they need it. They clean their homes or take care of their children if they're too sick to do it themselves. And a lot of times, those are the charities that need your help more than national charities. But the most important way to prevent this disease is through education. Know your family history, get tested regularly, and talk to the women in your life. Silence is deadly, and we all need to learn how to talk about difficult subjects. Any given woman has a 12% chance of getting breast cancer in her lifetime. Anyone is susceptible. There are a lot of factors that can increase your risk, and anyone can help to prevent this disease. Think about the women in your life. Prevent this disease from affecting your life and the lives of people that you care about. Spread the knowledge that you have now, because when you spread knowledge, you spread hope.